I'm not a scrub. You're a scrub. Subscribe for more. Alright. Tell me if my nose or my mouth is like on the screen. Trying to stay like this and not go like that, even though it feels better like that.
Today isn't just any other day. It's my first day. I'm the man.
You're the man?
Sometimes life can be so unpredictable. And if they had to do it all again.
And 4 years of pre-med, 4 years of med school, and tons of unpaid loans have made me realize one thing.
Good. Could you go drop an NG tube on the patient in 234 and call the attending if the lavage is positive?
I don't know Jack.
Yes. I still have that. I don't know, Jack. It feels so bad. I feel like I should don't know way more than I do. But I don't. Feels bad, man. One day I'll get there. But what she said, like, that's not the thing that'll make me realize that I don't know Jack. Let's be real here.
It made me realize one thing.
Good. Could you go drop an NG tube on the patient in 234 and call the attending if the lavage is positive?
So drop an NG tube just means insert a nasogastric tube, which means it goes through your nose and then it goes into your stomach and then you tape it and it stays there. It's like, it's not that hard or complex or anything. And the second thing she said,
could you go drop an NG tube on the patient in 234 and call the attending if the lavage is positive?
That's it. Call the attending that the lavage is positive. So the two things that she wants to do, that she wants him to do, that's making him realize that he doesn't know anything. Like, at least they're framing it that way. Is put a tube through the patient's nose and call the attending and say the lavage is positive. Am I not understanding what she's saying? Yeah, just going in there. Like, honestly, I don't know how he was so happy and confident going into the hospital. Like, he should have realized it way before he got there.
I don't know Jack.
I don't know Jack.
I'm no Superman.
I'm Dr. Bob Kelso, and I'm your chief of medicine. So I just want to encourage you
Hello,
all to think
Bob
of
Kelso.
me as your safety net.
Why are you talking like
I
this?
promise you, we're family here.
I appreciate the promise.
Hey! Are we, like, racing? Please, I'm not that desperate.
Ah! Oh my god! At least he's in the hospital, right?
Elliot Reed, John Dorian? Great. 1, I am your resident, Dr. Jeffrey Stedman.
Alright.
Not Jeff.
Did
2,
we ever see him
here are
again
your
in the
manuals.
series?
This is a
You ever notice how quickly some people make an impression?
I'm a tool. I'm a tool.
Oh, come
I'm
on.
a tool, an unbelievably annoying tool.
What? Why? You're so judgmental, JD.
Man, not Jeff. 2,
Oh, he said not
So
Jeff.
you
That's
do a
kind
lot
of
cardio or
that's kind of a tooly thing to
Elliot
say,
Reed,
but
John
other than
Dorian?
that,
Great. 1, I am your resident, Dr. Jeffrey Stedman. Not Jeff. 2, here are your manuals. This is a
You ever notice how quickly some people make an impression?
give people chances, guys. Don't be so quick to judge.
Yeah. Yeah, finally. These are your beepers. From now on, they control your entire life.
Beep beep.
Hey, thanks. Move it.
Back to today.
Okay, move it. I gave him a chance. All right, I gave him a chance. But I mean, judging people's characters on like 10 seconds of their life, I don't know. It's usually not that great of an idea. Let's be real here. So there's a basketball player named Jimmy Butler. He plays like a great game, and then his coach comes out and says like, "Oh, he wasn't Jimmy Butler there. He was James Butler." He was so mature out there. He was so good, and then they tell him this.
Coach came in here and he said this wasn't Jimmy Butler tonight. It was James Butler because how mature.
My name isn't James. Literally, it's Jimmy.
What do you? He talked about your maturity. What do you think?
My name isn't James. Literally, it's Jimmy. So yeah, if people call you Jeff all the time, leading with my name is Jeffrey, not Jeff. That's. I mean, it's okay, I guess. It's kind of annoying, but the move it, I don't know. I guess you can understand the move it as well. I don't know. First impression, not amazing, but still, Don't think he's a tool. Give him another chance or two.
Hey, that was Paige.
Oh, first day, Bambi.
Yeah.
Carla will take care of you. Don't look at me when we're moving somewhere.
Why?
We're waiting for Dr.
Why?
Hi, Doctor.
Place an IV for me.
We'll talk later. Come on, you've done this to cadavers before, so this guy's alive. Just poke it through his skin. Poke it through now.
Time's up. Carla, would you do it?
Wait. You've never started an IV in med
Pop
school?
up with it at home and splash.
Never?
I smell nice.
Zero?
Come on, you've done this to cadavers before, so this guy's alive. Just poke it through his skin. Poke it through.
So is this guy like not a doctor yet? Or is he a med student? No, he said 4 years of med school, blah, 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 blah. How do you go through 4 years of med school and not place a single IV? I don't think that's right. I guess it's possible. Like you didn't even try on your friend or something? Like something. I placed an IV before I even started medical school. Should I be saying that? I was like at my dad's friend's clinic. There was a nurse there, and she was kind enough to teach me on herself. How have you done this 0 times? I did it. I think I did it. I don't remember if I was successful. I think I bent it once. I think I did it. I don't know. I think so though. It feels better to remember that I did. Like eventually, I didn't do it on the first try or anything, but.
Why has this Gomer got to try and die every day during my lunch?
It's a little insensitive. Mistake.
Ben's 92 years old. He has full dementia. He doesn't even know we're here. He is inches from Carlo's rack, and he hasn't even flinched.
Oh, that is so sweet.
Yeah, it is.
What about his subconscious?
Eisenhower was a sissy. I think by the grace of God, we're going to be okay. Oh, and from now on, whenever I'm in the room, you're definitely not allowed to talk.
Honestly, I'm with JD here. Like, do we know for sure that nothing gets through to like people, like let's say under general anesthesia when they're in surgery and they feel pain? Are we sure that absolutely nothing goes through there? I don't know. I think there's a chance that they're conscious on some level.
Hey, nice clean job on the Foley catheter.
I had a nurse do it. Unfortunately, I'm still afraid to touch anybody.
Come on, what? Dude. I don't like this. How are you afraid to touch people? Did people not give you the grunt work when you were a student or something? Like, at all? And placing a Foley is basically... Here we go. Is this TMI? I don't know. It's putting a tube into the urethra, so urine just goes out into a bag and nowhere else. Right? It's one of the easiest things ever. It is. It really is. So nice clean job. I don't know how he tells that. I mean, it usually is pretty clean. Second of all, you didn't do it yourself? You were scared? Come on, man. Come on, man. Oh, come on. It's been like 10 minutes. This is what I absolutely hate about Scrubs. It revolves so much around random cross romantic relationships. Like, dude, you don't need... Come on, just stop. Just stop for 2 seconds. Please. And it's such a good show. It's such a good show despite that. Please. Just take a break. Focus on the medicine for 2 seconds.
Did you actually just page me to find out how much Tylenol to give to Mrs. Lenzner?
I was worried that it could exacerbate the patient's...
It's regular strength Tylenol. Here's what you do. Get her to open her mouth, take a handful, and throw it at her. Whatever sticks, that's the correct dosage. And under no circumstances are you to compromise our no talking agreement.
Alright, I'm with Dr. Cox on this one. You need to learn to have confidence in your decisions because, like, you're not making it up. If you are, then by all means, go ask someone. But you obviously know the answer because you gave it. So don't what's it called? Overthink every decision? If you know it's right, it's probably right.
It's just that this isn't really what I expected, you know. Most of my patients are, older and sort of checked out mentally.
Lumpkin, that's modern medicine. Advances that keep people alive who should have died a long time ago, back when they lost what made them people. Now, your job is to stay sane enough so that when someone does come in that you actually can help, you're not so brain dead that you can't function, for the love of God. What?
Everything we should be talking about.
What about the subconscious?
She's dead. Write this down, Nubby. If you push around a stiff, nobody will ask you to do anything.
He's been like a father.
Fair enough.
I actually never thought of that. But also, I don't think that's true. I think that's only true for an attending. Like, if I was a resident or something, pushing around the patient, and someone needed something, wouldn't they just say, "Can you come and do this for me when you're done?" I think they would. So, I was considering it, but I'm not gonna try it.
Not really dead.
It's something that I think we just gotta follow. Cock's enormous. I wouldn't have said that. No, I didn't fall for it. But this is Dr. Cox. His name is Cox. And some people call him Coxie. Take that. Surgery bros.
All right, Todd, JD, this is my man Todd. Let's go.
And like that, I was back in high school.
High school. How are you doing? Was that a dumb joke? I think it wasn't. It was one of the smartest jokes ever made.
You see, surgical interns, they're all slice them and dice them. They're the jocks. Medical interns, we're trained to think about the body. Diagnose, test. Medical interns, well,
You got a stain.
we're the chess club.
Guys. Surgery's the coolest thing ever, though. You get some sort of scan. You see there's something there. You know what it is. You go in. You take it out. Bada bim, bada bim. Nema problema anymore.
I just have bad gas. What are you testing me for?
We need to know if your gas could be harmful to others.
What?
He's just scared. Talk to him.
Look, Mr. Bursky, I heard a systolic murmur in your heart, which is most likely nothing. But if you don't let me check you out, I'm gonna worry about you all day.
Then I'll do it.
How is it harmful to others? Is that did that happen in his head or something? A systolic murmur is just like a different sound in your heart. Harmful to others?
You're a good
Other
man.
organs?
It'll be fifth time or so. It don't open.
Maybe there's a penny stuck in there.
Why a penny?
I don't know.
Maybe a nickel.
Did you stick a penny in there?
No, I was just making small talk.
If I find a penny in there, I'm taking you down.
Fair though, fair. To do that small talk is to take a risk. Was it worth it? Absolutely. But will you pay the price? Absolutely.
Most likely indicate what, Dr. Dorian?
Sir, I have no idea.
Dr. Reed, can you help him out?
I'd say it's superior mesenteric insufficiency.
That's my girl. Patient number 2.
Trust broken. All for one question.
My first code. See, here's how it works. Someone's heart fails, they beep everyone. The first doctor in has to run the room and tell everyone what to do. Basically decide if the patient lives or dies.
Excuse me? What?
What's my point?
Really? Don't they have like anesthesiologists or, I don't know, an actual designated team for every place for that? You know? They page every doctor in the hospital? Every doctor in the hospital. Okay. Let's say they do. Let's say everybody gets paged. And then everybody says, all right, I guess we have work to do. Everyone leaves their work and then goes to that one patient, and then there's 35 doctors looking at one patient, and they're like, oh, well, that was a waste of time. Let's go back to work. Alternatively, next time, it's going to be like the boy who cried code blue, and then they're going to look, all right, 35 people are going to go there anyway, so maybe I'll skip this one. And then nobody goes. and then the patient doesn't make it. I don't think that's how it works. Here, they announce it like through the PA, but they don't page the whole. They don't page every doctor ever. Also, we don't have pagers. I've never seen one in my life, like I said before. So maybe they do page every doctor. I don't know. I don't know what pagers do.
Don't worry about the patient. Turk was already there, learning by doing.
Charge, clear!
Plus, it turns out the guy was just sleeping, attached to a faulty monitor.
Charge, clear!
Plus,
why is he not hooked up to an EKG or
attached
anything?
to a faulty monitor.
Maybe the monitor wasn't the thing that was faulty.
Right. Pass me a tray kit. Thanks.
Dude, he doesn't know. What? That's impossible. All right. Listen, chat. You're scared of touching a patient. You've never inserted an IV line. No Foley catheters. No nothing. Fine. I'm okay with that. All right. All of that is actually realistic. It's possible, but it's your first day. Your first day. And someone comes into the closet and tells you, pass me the tray kit. And you know exactly where it is. And you take it and you hand it to him? That is not happening. That is not realistic. Like I could be somewhere for months and still not know where everything is.
Wait a second, champ. You got a urine sample in there for me?
But I just did 5 minutes ago.
I know you did, but here's the thing. I'd like you to take this cup, put it on the ground, close your eyes, and just go nuts. What do you say? Boy, go get him, champ.
He's so nice.
Why are you here?
Seems like a good kid.
You're worried about being on call tonight, aren't you?
Yeah.
Look, worst case scenario, you kill somebody, and that hangs over your head the rest of your life. But that is the absolute worst case scenario.
What's the worst that can happen? I'll tell ya. Someone that was gonna die anyway, maybe a couple years, couple decades down the line, is gonna die anyway. Wait, why did he flush? Didn't he put it on the ground and just go nuts? He didn't listen to the doctor.
I'm a doctor, okay? The stethoscope, the beeper, a doctor. Got it? Relax.
That's not very relatable to me, but I'm sure it's very, very relatable to a lot of people.
This is fun.
Hey, nurse.
I'm a doctor, okay? The stethoscope, the beeper, a doctor. Got it?
Hey, nurse. I'm stealing my my sister's story here, but so they were sitting with their scrubs and their stethoscope, and then I think I'm gonna say some patient comes to them. He was like, "Oh, are you guys nurses? That's so cool. Good for you." Blah blah blah. and they're like, "No, we're not nurses." And they're like, "Oh, it's okay. It's okay. You're the nurses of the future. All right, goodbye." It's a sad but funny moment, but he didn't even consider the possibility. It's probably the most realistic thing
in the closet again.
they did in this episode yet.
He crashed. The attending thinks it was a pulmonary embolism.
Aww.
No way anyone could have caught it. Could you?
A pulmonary embolism is just a clot that let's say a clot forms in your legs, and then it doesn't break up. It stays there. There are a bunch of risk factors, like not moving and lying down all day is one of them. And then that clot gets dislodged without breaking up at all. And then it moves and moves and moves. And then when the veins get smaller, it gets stuck. And if that place is in the lungs, well then, that could kill you.
Just pronounce him so I can go home.
I'll never forget that
Just
moment.
Muslims not go home.
The way he looked exactly the same, only completely
Totally
different. The shame that all I could think about was how hard this was for me.
What about his
I was there for
family?
200.
Whoa, what? I guess you let the nurses do that as well.
I could think about was how hard this was for me.
Let me see. Yep. He's dead.
Time of death 0200.
Yep. Looks pretty dead to me. I mean, I don't know about you, but look at him.
The hardest part is how quickly you have to move on.
That was kind of profound, though.
The hardest part is how quickly you have to move on.
The hardest part is how quickly you have to move on.
We gotta relieve the pressure in his chest. JD, do it.
Oh God, no.
Look at me. You can do this.
And I believed him.
Chest tube tray.
You know, kinda.
Come on, baby, let's go. Chop, chop.
You can do this. You have to do this.
JD, cut him or lose him.
Okay, give me the tube.
He barely grazed the skin, but alright.
Okay, connect it, please, Carla.
Normal rhythm.
No way.
Hey?
No way.
It's a piece of cake. It's your patient.
You're leaving?
He's so nice.
That's your patient, doctor.
No, do it! Please do it! No!
Good. That's enough.
Sorry. It's a very big moment for me. So I guess that's it for now. The most important thing is that I got through my first 3 days without looking like a complete idiot.
Right.
I'm the man.
You still don't look like a complete idiot, though. I think you still have potential to go up. Alright, chat. Alright, chat. Fun stream. We should watch series more often. That was fun.
Meow, 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 meow. Bear, 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 bear.
Meow Mix. High quality ingredients for great taste and complete nutrition. Tastes so good, cats ask for it by name. Meow.
Shut up, it's good. It's good! Shut up. It's good. I need some suggestions on any other medical TV show or specific episode you'd like me to review. Let me know in the comments. In the meanwhile, here's another medical drama that I already reviewed. Check that out and subscribe.